I'm very pleased to welcome and host the Canadian Nurses Association. You all know perhaps my background is nursing before I went into politics, so there's a place in my heart for every one of our people here. Nurses they are with you at your birth and at your death, and they spend a great deal of time with you in your most dire moments. And so, on behalf of all of us, I really welcome you, and I'd like to introduce the president of the Canadian Nurses Association, Dr. Judith Shamian.
Hello everyone, and thank you Senator Olson. Senator Olson has been a great supporter of the Canadian Nurses Association as recently as last May when we had a terrific gala, the first one in town. Senator Olson was the co-host of that gala, and we are very grateful for her ongoing support. And once you're a nurse, you're always a nurse. So you are in very good hands tonight. There are a lot of nurses in the room, but there are also several nurse politicians. So between us and nurse politicians and others, you are in terrific hands. So today, the CNA, the Canadian Nursing Association Board, is in town for this week, and we decided to have a lobby day. We haven't had a lobby day for a long time, and we decided that there are urgent issues and it's time to go out, meet and connect and discuss and reconnect with a lot of all the new colleagues. We have had over 40 meetings today, which I think just symbolize how important the agenda and how great you are in opening your doors and receiving us and talking to us. I know that today has been a very busy day on the Hill, and you making time for us was very special. We came to communicate a couple of key messages. We came to remind all of us that healthcare is very important. Healthcare is still the burning issue and agenda among Canadians. And we came to talk about what the Canadian Nurses Association believes that is essential and the transformation that needs to happen in this country. We are spending a lot of time to reflect on healthcare overall, but specifically focused on being aware that the accord is around the corner and specific discussions going on. You cannot open a paper, or you probably have a visitor that comes through your doors has some stories to tell about the healthcare agenda. And we are here to tell you that we are wanting to work, if it is with our medical colleagues, politicians, provinces, and so on. The Canadian Nursing Association has undertaken a cross-country tour, and last week, for example, I was privileged to be in Manitoba, spend some time with the Premier and others, and seeing what's going on from coast to coast is terrific. Along the same line, because we realize the importance of developing a strong future policy that responds to the need of Canadians, we launched an independent national expert commission on May 2011. And we wanted an independent commission to help us to provide further input and thinking of what needs to be done to build the very strong healthcare system that we have and make it stronger. And let's not kid ourselves, we have a lot of challenges. So just throw some figures around. If you look at infant mortality, we used to be among the top 10 in the OECD countries. We slided to close to being in the 20th among the 34 and so on. And there are many other examples. Every 13 bed days that you look at across the country is taken up by unnecessary admission that can be looked after in the home. And families across this country needing support, and we need investment in home care. But enough of that, and let me talk about the Commission for a minute and introduce you to the Commission itself. The Commission is co-chaired by two very well-known, very highly respected Canadian women. It's co-chaired by Dr. Marlene Smadou, who is the past president of the Canadian Nurses Association. She's currently the Associate Dean of the College of Nursing at University of Saskatchewan. and she's also a vice president of the International Council of Nurses. So Canada is very well represented in the international nursing agenda. The other co-chair who we are very privileged to have here with us tonight is Maureen McTeer. She's a respected Canadian lawyer and author, and I'm sure she's known to all of you. She's a leading health advocate and symbol of gender equality in Canada. And she has a long career in advocacy in women's health, including maternal and reproductive health, and in the broadest areas of social justice, promoting democracy and medical ethics. We have been very fortunate to have Maureen and Marlene to co-lead this very important initiative that we are at the Canadian Nursing Association Board eagerly waiting for their independent report to be delivered next June. And I am sure that it will offer additional policy perspective that will be very important to our continuing work. Maureen, please come to the
Thank you very much, Judith, and thank all of you who have taken the time, made time actually, out of your, I know how busy MP schedules and minister schedules are, and I really am appreciative. I see the Minister of Justice here, which warms the cockles of my legal heart. I can tell you many stories about that Minister of Justice. Some distant place in Russia, but we'll hold off for another time. We did do some international travel together and had a very wonderful time. I also saw Peter Van Loan here. I hope he didn't just come for the food. Oh yes, that's right. Because I'm sure you'd love to hear what I have to say. I want to thank Senator Stuart Olson also for hosting us all. It's an absolutely wonderful opportunity, and I understand from Judith and others that you just had an absolutely wonderful day in terms of your lobby day, and I'm glad that you started it again, making it an annual event. I'm actually one of 3 M's. Marlene was introduced, as was I, but Mike is here too, Mike Villeneuve, and they call us the 3 M's over at the Canadian Nurses Association. I assume with warmth and caring, but anyhow, Mike, put your hand up there. Don't sit down. Come on, put your hand up. We've had a great time, Mike and I, going around Western Canada, getting information and knowledge from nurses and people who are involved in the delivery of health care. I'm referred kindly as the non-nurse co-chair. Again, it's always put in, which never lets me forget that I am a non-nurse in the room. But I'm also, and I noticed, Judith, you did it again, I'm always referred to as a respected lawyer, as if somehow most of us aren't. And therefore, it is an adjective that applies to me individually, specifically, but not necessarily to my profession. So we're going to get that changed on our word processors, or whatever we call them now. Co-chairing this expert commission is an honor and a challenge for me. An honor because of the trust that the Canadian Nurses Association have placed in me to do this work, and a challenge because of the importance that Canadians attach to the work that we are all now engaged in nationally. An Environics poll released last week found that fully 85% of Canadians recently polled on an immigration question felt that our healthcare system is a very important symbol of our Canadian identity. And all of you here know that healthcare remains the #1 issue for Canadians. That means that we must get it right. And never before has it been more important than now, as we prepare for the next decade of healthcare in Canada after the end of the Healthcare Accord in 2014. L'Association des infirmières et des infirmiers du Canada se met au premier plan de cette discussion nationale en établissant une commission nationale d'experts. Nous demandons à la population canadienne de partager leurs idées et de nous offrir leurs conseils afin que nous puissions rédiger des recommandations qui vous aideront, vous comme parlementaires, de transformer notre système de soins de santé au Canada et d'assurer la place primordiale des infirmières et des infirmiers qui pratiquent dans toutes les provinces et territoires du Canada. The Expert Commission has been active across Canada, as Judith has mentioned during our past few months, as well as the CNA. Often we've been going in tandem to different parts of the country. And what we've learned will add to both the relevance and to the currency of our final report that will be released at the CNA's meeting in June of 2014. Gave us a bit more time there, Judith. 2012, next June in Vancouver. Our basic purpose as an expert commission is to generate policy solutions that support the positive transformation of our public healthcare system. To do this, we need to also transform the way that we think about health and health care in Canada. The hospital-based, acute care, doctor-directed approach to service delivery will always have an important role in Canada. But it is a sickness model and will not alone ensure healthy Canadians in the changing world in which we live, where we live longer, we face more age-related and lifestyle-driven diseases and conditions, and where the social determinants of health, from poverty, disability, addiction, deprivation, poor housing, and lack of economic and educational opportunities, to name but some, will play an ever-important role in determining who will and who will not be healthy. Our mantra at the Commission says it all. We want our system to provide better health for all Canadians, better care for each of us, and better value for the money that we spend. We have added a fourth category at the Commission, thanks to the College and Association of Alberta, who suggested that we include best nursing. We believe that nurses can and must provide the leadership and innovation needed to ensure better health, better care, and better value, all of which, together, will help ensure that our public healthcare system is sustainable and meets the real needs of Canadians in the decade ahead. In that, I urge all national associations and groups to come together to work on a consensus on priorities and choices to be presented to governments. And I ask Parliament to do likewise, for these are not partisan issues. The health of Canadians and the very future of our cherished healthcare system is a national challenge, and one that each and every one of us, no matter what political affiliation or personal career or lifestyle we have a role in achieving, in enhancing, in fact, in ensuring. Now, it's no small task that the CNA has given us in our mandate, and in our efforts, we will be calling on many of your own constituents to give us help. And I appreciate your attendance here, I appreciate your attention, and on my own behalf and that of Marlene, and Mike, and all of those who've entrusted us at the CNA under Judith and Rachel's leadership, I look forward to your help in achieving our common goals. Thank you very much.